You mentioned the need to do more than we've done, and I'm wondering how the national healthcare scene is affecting what we're doing here, and what are some of the thoughts about really getting the cost down? And I know how complicated that is, and I know it's a difficult question, but your thoughts on it, I think, would be
So here's what I have experienced. First of all, let me say a word about the national scene, and then bring it home.
Sure.
The simple thing to say about the national scene is that national health care is good for Massachusetts. It's good for us. First of all, it's not the debate is not so scary for me because we're doing a lot of what they're talking about in Washington. And in both the House and the Senate versions, we get some additional federal resources to help pay for what we're doing here. So that's good. That's good. Otherwise, we basically get to continue to do what we have been doing. And the other, just a footnote I'll drop out there because you hear it from time to time, healthcare reform has added about 1% to the state budget. It has not been a budget problem. The issue for us is the same issue as in the states that don't have a universal system, and that is your neighbor's problem, which is the multiple, the double-digit rises.
Self-employed.
And that's the worst. So individuals and small businesses are having the worst. Now that is not because of health reform.
Right.
That is happening everywhere. And I hear the stories. There's a small law firm in Worcester. I heard about they were going to add 2.5 positions, 2 lawyers and a part-time receptionist. They got a 24% increase in their insurance. They can't do it. Small brokerage firm, insurance brokerage firm, 55% increase in 1 year. And the problem with that is that it's unaffordable on it and unsustainable on its own. But if small businesses, which are 85% of the businesses in this Commonwealth, aren't able to hire, we are not going to have a recovery. So we have a long-term strategy. When I say long-term, I mean 5 years that we've been working on anyway, which is payment reform.
Right.
Moving away from moving away from fee-for-service to global payments. That's a 5-year plan. It's a good plan. It's the right plan, but we need relief right now. And so last month we filed a bill to give the administration some emergency power, essentially to put a soft cap on insurance premiums right now. The medical inflation rate is 4.5%. 18%, 30% increases in insurance premiums are way out of line. And so we basically said, start there. If you don't get to go above, we're not saying no increases, but you don't get to go above medical inflation unless you have a very close condition why you can. Now the insurers have pushed back, and I understand this by saying, well, the provider rates, the hospitals, are pushing them up, and which is why we filed the legislation, because we're trying to do the same soft cap there as we're doing with the insurers, so it's in balance. Please, Mr. Chairman, Representative, we would love to have your support on the committee. And the jobs, please.
Governor in the neighborhood, I'm Kevin. Call me Mr. Chairman. One of the big issues we deal with, Mike Moran and Mark, is employment issues. And I know you've been terrific on trying to stimulate the economy and get more jobs out here. But that's the issue.
Number one.
That's the issue we tend to deal with in the neighborhood.
And a couple of things I would say on that. First of all, you deal with it in the neighborhood, and I deal with it all over the Commonwealth. It's the number one thing on people's minds. And we didn't first start addressing the need for a stronger economy and employment opportunities when the economy got so bad or employment went so high. This is what we've been doing. All those infrastructure investments are about jobs right now. Right now. There are 500 road, rail, and bridge projects right now, and another 100 more before the summer. We got the stimulus bill. That's another bugaboo out there. There are 25,000 individuals with Social Security numbers we can point to who are working today who would not be working but for the stimulus spend here. And we get whacked because we make decisions sometimes on how to take some of that federal money and leverage private money or leverage state money so we can get even more jobs. But I'll give you an example. I think it's wise. I'll give you an example. With 71 wastewater treatment plant projects in the queue, $400 million. We leveraged that to $800 million, 115 projects. That's 4,000 construction jobs this spring around that, just related to wastewater treatment, because we took a couple of extra weeks to leverage that federal money in that way. But again, back to the point about where the hiring must come from. It must come from small business. If they don't hire, we don't get a recovery, because that's where most people work. And what they say they need are two things. Well, a number of things, but two things most prominently. Access to capital, because the community banks are still not, they're stable, but they're not lending. And relief from their health insurance premiums, and that's what's in this jobs bill that's before the legislature. And to the legislature's credit, it's moving quite quickly. Their hearings, it's been broken up into 5 or 6 parts. And there have been hearings on all but 2, and those hearings will happen this week, and then the Speaker says he's going to pull the elements back together, and we'll have some legislation soon. Anybody else?